Good evening, I'm Tom Hepworth. New figures compiled by the BBC reveal how many of our hospitals are struggling to discharge patients once they've completed treatment, leaving hundreds of people stuck on wards each day, even though they're ready to go home. It's the problem of delayed discharges, sometimes called bed blocking, where patients are waiting for other support, such as carers at home or a bed in the community. The figures reveal a big difference between some hospitals, with two of our trusts among those with the biggest problems in England. With more, here's our health correspondent, Alistair Fee.
Getting hospital patients home is a daily challenge. New NHS data from June 2022 to this summer now reveals the size of the problem. The figures show that on average, Hampshire hospitals, which includes Basingstoke, Winchester and Andover, could only discharge 1 in 5 patients each day who were medically fit to go home. On the worst day last year, that meant more than 220 patients left on the wards who didn't need to be there. The problem was on a similar scale at St Mary's Hospital on the Isle of Wight, Salisbury Hospital and at the trust which runs Bournemouth and Poole. There are many ways that trusts have been trying to manage this challenge. Last winter, the Queen Alexandra in Portsmouth began picking up patients, taking them home and settling them in, making sure they had everything they needed to stay out of hospital. And in Bournemouth and Poole hospitals, last year the trust used a local hotel where patients were transferred to help free up beds. Hampshire Hospitals is among 10 across the UK experiencing the greatest delays. In a statement today, they've said that getting patients home is governed by a range of factors that are sometimes beyond the direct control of the hospital, and said that partner organisations are all part of the puzzle. It's hoping virtual wards where patients are monitored at home can help. The best performing regionally was the Royal Surrey, regularly discharging 6 out of 10 eligible patients. But even it had days when not a single patient could be allowed home. Oxford University Hospitals and the Royal Berkshire also performed well. As we move into the colder months, this challenge will grow. Last winter, the number of patients unable to go home was almost double what it was a decade ago.
Well, Al is here with us now. Al, this isn't just about hospitals, is it?
That's right, Tom. The issue is much wider than that. The government has given £1.6 billion to address this problem, so big sums of money. The Nuffield Trust has welcomed that money, but is calling for proper reform as well as those injections of cash. The Royal College of Nursing says at the heart of the problem is staff shortages. That will come as no surprise to many. They're calling for a long-term plan to fix adult social care. I think everyone agrees that to reduce the number of people stuck in hospital beds, you need to address care at home and in the community. But to date, no one's managed to achieve that.
A complex situation. Al, thank you very much indeed.